Okay, so welcome everybody. I'm going to start with a quick round of introductions. Let me get this bar out of my way. So today our agenda will be a quick welcome and introduction to Children's Health Data Partnership Project, a demonstration of the dashboard from our partners at Kids Count, and then some question and answer time. And we can really go to our heart's content with that. My name is Stephanie Morton. I'm the program manager for Healthy Babies. And I'm delighted to see so many folks here. I'm going to turn it over to Bree to introduce herself.
Hi, everybody. I'm Bree McLaurin, and I'm the executive director here at Healthy Mothers, Healthy Babies.
And Xana, do you want to introduce?
Yeah, you bet. Sorry. Hi, everybody. I'm Xana Berg, and I'm the director of Kids Count. We're a project of the Montana Budget and Policy Center, and I'm going to pass it over to our last introduction with Danny.
Hi, my name is Danny Power. I've been working with Xana on the Kids Count data dashboard. I started it as the capstone for my MPH program at the University of Montana, and I've just been working with her to try and finish out the project.
Great. Yay, thank you. We're delighted to have everybody here to talk about this. And now I'm going to turn it over to Bree McLaurin to give you the background on where the data project came from, the why and the how, and a little bit of the what's next.
Excellent. Thanks, Steph. So many familiar faces. It's so great to see so many of you that were at the table years and years ago when this all kind of started, and welcome to those who have joined us along the way. So kind of what Steph said, and just to let you know, I have a mom conflict this afternoon as well. My middle schooler is receiving an award at 1, so I'm gonna leave at 12:30. I'll miss the Q&A, but Steph can do that for us. So, you know, a lot's been happening in early childhood in Montana. It's been incredible to watch our infrastructure grow and develop, as well as our public health systems. And so really just wanted to kind of catch you up from kind of where this all started and where we are today. And so, you know, in 2013 through about 2017, there was a significant investment in early childhood infrastructure by supporting early childhood coalitions across the state and giving all sorts of training on how to build a coalition and how to talk about the importance of early childhood and all sorts of awesome stuff that happened. And in that time, there was a statewide conversation called Best Beginnings. Deb Halliday, hi Deb, who's here. She was a big leader for us, teaching us all about collective impact and how we move community conversations forward in a way that kind of brings us all to the table and moves us together towards the same goals. And then also there was this really incredible kind of tangential awareness going on about ACEs, adverse childhood experiences. So there was lots and lots of training about the impact of adversity on early childhood. And this question about really like what's next, which really kind of propelled us into this, like, what role do coalitions play in these conversations? Next slide, please. And at the same time, the ACA was really getting going. And so the Affordable Care Act was mandating that nonprofit hospitals make plans. Local health departments were working on accreditation, and local health departments were now really looking at how they're measuring change in their community's health priorities. And in some communities, maternal child health was a priority. And in some communities, maternal child health wasn't a priority at all. And so as we were really looking across the state, trying to find, you know, ways people were measuring, ways people were talking about, how do you measure the impact of a coalition, we really hit this yellow cone. And so let's see, next step. And so this yellow cone happened because we really came together on this common agenda. Yeah, brain development happens in the first 5 years of life. People are gathering on the understanding that, you know, early investments really impact long-term health outcomes. There's coordinating bodies locally, health departments, hospitals, coalitions are coming to the table. We're talking, we're making plans, we're coming up with interventions and strategies to work, but it was still really hard to measure it. And that's really kind of when we all had this idea, like, what if we could agree on some early childhood measures by which we could align our health improvement activities or our coalition activities, and then we could compare across counties with similar demographics. What if we had that data available? So that's really where the history of this project came from. And then Steph, at that time, she joined Healthy Mothers, Healthy Babies as a student. And if you want to just give a quick synopsis of your practicum.
Yeah, so I got the joy of having Healthy Mothers, Healthy Babies be my second year practicum site as part of my Master's in Social Work study. And Bree set me on the task of reviewing all the CHIPs and CHAs that were, from all the counties and hospitals across the state. And specifically what I was looking for was maternal and child health measures. What I found was that it was difficult for folks to access local or county level data. So a lot of people, if they did cite any maternal and child health, had state level data and or national level data even. As well as common as those like very limited data sets, there was just no measurement. And there was really no consistency across all of the reports I ended up reading. There was also just a lack of opportunities for coalition leaders and for folks even who were doing CHIP-CHA processes and like trying to participate in those as early childhood specialists to work to understand and get more of that data into those reports and really ultimately, push the reporting straight into action plans in those CHIPs. So, yeah.
Thanks, Steph. And for all that work you did back then, it really did fuel us into this next step of the project where we looked for some funding. And we realized there was a couple there was need to measure data the same, and there was this emerging science at the same time called health outcomes from positive experiences, and I'll kind of go into that at the same time. But in that what's next question around ACEs, we all know that some people with a 10 out of 10 of ACEs, fare really well as an adult, and some people really struggle. And as we were all getting trained and we were getting questions from our communities about, well, I have a 9, but I'm doing okay, and I have a 6, but I'm really struggling. We really wanted to say, like, well, resiliency really plays a role, and in thinking about data, what we measure, we value. So it's really important to think about measuring health data, especially when we're thinking about early childhood from a strengths-based perspective, and really trying to quantify resiliency in our state as well. And I'm just going to give a little call out to my buddy Gary Gannon on the call from Saigaya. He really helped me think through how to measure the positive as well, and different metrics that are kind of being used in other sectors of the economy. And it really helped us kind of come down to this science that and identify some scientists that we had on the team that helped us realize that there's new data available. There's new ways to collect information on the impacts of health outcomes from positive experiences. Now they're kind of calling them PCEs, positive childhood experiences. And so how do we balance that? And so that was kind of happening at the same time of this project. And so we were really, really lucky. You can go to the next. Actually, I'll go through the kind of the calendar. Sorry, Steph, I got ahead of myself. So it's been a long process. We've been at this for a while. So I'm pretty excited to share this with you today. So 2018, 2019 was when our plan really was developed and the measures were developed. And I'll tell you how we got there. And then after we had our plan, it took a little time to find some funding to be able to implement the plan. At the same time, we were able to implement, add the HOPE module from this health outcomes from positive experiences, which was a CDC BRFIS module, to our Montana BRFIS. And then we, over the last couple of years, have been implementing our strategic plan, and today's our launch. So that's the timeline. And we've had lots of partners at the table. A huge thank you to Montana Healthcare Foundation, Headwaters Foundation, DPHHS. They have been our funders along the way. And that was just incredible over the years to stick with the program like we did. And you know, at HMHB, me and Steph have been kind of carrying this for several years, but we've had incredible partners and consultants. Sarah Corberly and Deb Halliday helped create the measures and the plan. Dr. Jeff Linkenbach and Dr. Bob Sedgy are the principal investigators of the HOPE research, and they were on our team. Katie Loveland, who's awesome with data and does a ton of work in Chip and Chaws, and she helped us with data measures. And along the way, we got to meet Xana as she came to Montana and took the role of the director of the Kids Count. And Xana right away saw the value and jumped on as a partner. And now we have Danny's help too. And that's kind of the folks internally that have been working. But you can go to the next slide, Steph, because really it was with tons and tons of partners too. We're going to share the slides just for time's sake. If you want to read some of the background about HOPE and listen to a presentation from Bob Sedgy, there's some links in the presentation. You can go ahead, Steph. So quickly, just kind of to scan through this, we tried to get anybody with kind of a network of influence over use of data and thinking through data decisions, data sharing. And we also really went into thinking about different partners whose this data might influence policy decisions. So all these people listed were at the table while we did our work in that first year. And what was really kind of special about this project is not only did we have the directors of Blue Cross Blue Shield, DPHHS administration, you know, hospital leadership, we also paired them with the leaders of the coalitions and the local coalitions. So we had all these different local early childhood coalitions represented sitting at the same table. And so when perhaps a person thought, man, baby friendly hospital initiative, that's a great thing. We should all, you know, maybe we should have that be a measure of success. A local coalition coordinator may say, we don't really have a great way to influence hospital policy, so that really won't work for us. So that got scratched. So with this kind of back and forth conversation over several months, we were able to come up with some criteria that we really wanted there to be impact on children. We wanted to be accessible, as in anybody can access this data. It needed to be actionable, so local community coalition change agents could do something about it. So it might be valuable, but maybe we were thinking about, you know, one thing that came up was homelessness. It was really important to everybody, but it didn't fit our criteria, for example, because we didn't have the data. There wasn't a whole lot of action that local coalitions felt they could take on it, and it wasn't culturally relevant because the tribal definition of homelessness didn't fit the non-tribal definition, and so that was another one that got scratched. So, and then high quality was our other criteria. And so after many meetings and looking at the data and all of the science and what, you know, fit the criteria, we did develop measures that were endorsed both by leaders of these big data sets and also local coalition leaders that said, yeah, we can get behind trying to improve these numbers in our communities too. And so they are, you know, percentage of women who initiated prenatal care in their first trimester, quality well child check rates, low birth weight babies, postpartum checks within 60 days, 2-year-olds getting their immunizations on time, home visiting, number of children who attend quality childcare and or early education, 3rd grade reading level proficiencies, foster care rates for children ages 0 to 5, and WIC rates for children. And what's really, really cool is some of this data was never available locally until this project. We made some big strides. So Steph, I'll let you talk for a minute. I'll get my coffee.
Yeah. So if you do want to learn like a little bit more detailed timeline and understanding of their project, we do have a report. It's available on our website. You can find the link here. It'll also be sent out in any follow-up pieces. As far as next steps that we're seeing, watch for the Hope Burfus data that was collected in 2022. That report will be coming out this fall. We're very excited to be able to include some resilience factors with it alongside risk factors to understand, like one of those pieces of ACEs is they're not actionable generally, right? But what can we do to decrease the impacts? And one of those things is build resilience and positive childhood experiences. So we'll be excited to see some Montana specific data about those pieces. Developing data dashboard in partnership with Kids Count. Check. So this has been a wonderful launch for us and a big step in this project. I'm excited for Danny to share the dashboard with y'all. And then promote use of the dashboard in local community health planning efforts. And that starts today. And if y'all have great ideas about how this can be reflected and used in your work, we'd love to hear them. So I will turn it over to Danny.
Perfect. Thank you so much, Stephanie and Bree. I'm going to go ahead and share my screen. All right. Can everyone see the data dashboard there? Perfect. All right, so as I touched on before, my name is Danny Power. I originally came on board with the project as I was completing my master's in public health and have had a long interest in data and childhood health, having worked with Seattle Children's Hospital in the past and doing research there. And so we kind of started this project, Xana and I on our end. We did a lot of interviews with stakeholders, meeting with programs within Missoula County, Silverboe County, and doing some meetings with like Yellowstone and Bighorn as well. And just sort of trying to figure out how to build a dashboard that's gonna meet as many stakeholders across the state's needs as possible. So this is our launched dashboard. I believe it was linked in the email that was sent out with this meeting if you wanna pull it up yourself. But I just wanna walk through sort of how the dashboard works so that you can feel comfortable utilizing it and pulling out the information that might help you in your public health efforts. So here in the main dashboard, we can toggle between the state profile and the county profile using the button here at the top. So here I can get all of the kids count data metrics for the state. And then if I switch back to the county, I can select certain counties and the numbers will reflect what's going on in each county individually. So I'm going to walk through just a couple of these just to sort of get a feel for how the dashboard functions. So for the first one, I'm going to go ahead and use Lewis and Clark as my example, and I'm going to go to the WIC dashboard. So moving between the dashboards is fairly simple. You're just going to click on your icons here and it'll take you to the dashboard. So now I have my very specific WIC dashboard, and it begins with a brief summary of like what WIC is, why it's important to childhood health, why we're measuring it, why it's included in these measures. And then our main map here shows us the rate of eligible children who participated in WIC in each county for 2021. So here I can see that for Lewis and Clark County, that was 68%. You'll notice that some counties don't show any participation numbers. Whenever that happens within this dashboard, that's generally due to the number of participants being too low, and we need to suppress that data for privacy concerns. And then as I scroll to the bottom here, I have a few different graphs that I can choose between. So the first is a number of participants. So it's presented as a stacked bar chart. Here we can see that in 2021, Lewis and Clark County had 810 children participating in WIC and 319 mothers participating for a total of 1,129 participants. So this chart allows us to see the breakdown in mothers and children utilizing WIC, and then also be able to see that over time as it changes. And then we can also toggle to percent of eligible children. So that's the same metric that's presented in the map, but now we can see it plotted over time to see how things are changing. So this is calculated using the percent of 0 to 5-year-olds living within the county underneath that 185% poverty level that's necessary to be considered WIC eligible. And then we put that as the denominator and then use the number of WIC participants as the numerator to calculate our percentage. So this shows us how well WIC is being utilized in the community. Ideally, we're wanting it to be as close to 100% as possible so that everyone's getting the help and the needs that they're entitled to. And tracking this over time, we're hoping that you can use this to evaluate WIC outreach programs, awareness campaigns, helping more families seek assistance through the WIC program. And then the nice thing about this dashboard is if any of this information, you want to print it out, you can come up to the top here and there's a download PDF button. So you click on that, it'll automatically generate a PDF that's printer friendly. You can print it out and have it for your records. And then we also have at the bottom of these dashboards, we do have video tutorials that I've made just in case you need a walkthrough again as far as how to operate the dashboard or what some of the metrics mean. And then when I'm done with looking at a certain dashboard, I can come up here and go back to the home page fairly quickly. So now we'll look at another one. This time we'll go with low birth weight. So here we have the low birth weight metric. And so now we can see percent of babies born at low birth weight over the 2016 to 2020 period. Again, we have a lot, because there's a lot fewer low birth weights, you're going to see more counties that have suppressed data here. I do want to draw attention to one thing we have on all of these dashboards is comparing rates to the Montana state average, the urban average, and the rural counties average. And you'll find at the bottom of the dashboard, here we have a note on which counties are considered urban versus rural. This was sort of decided out based upon both population and largest urban center in each county, just to paint a picture for sort of those two different settings within our Montana communities. Let's see. So one thing I want to touch on here is that we do have at the bottom of this one, you can toggle between 1 year, 3 year, and 5 year data. So this is one way that we can kind of track between different data periods. This helps a lot with these smaller counties as far as some of these counties probably don't have enough low birth weight births to be captured in 1 year data without needing to suppress for privacy. So by putting those into 5 year buckets, it allows us to be able to map things more and be able to share that data. So we can go to like Lewis and Clark and we can toggle between our 1 year, our 3 year, and our 5 year averages. Again, with this one, you can print it out as a PDF. You can also print just the main dashboard that has all 10 measures. You can also download that as a PDF and be able to have that for your records. That's most of what I have. I don't want to overwhelm right out the gate. That's just kind of a basic overview of how to navigate through the dashboard. And yeah.
Thanks, Danny. I might just follow up with a couple more comments because I anticipate the group might ask this question. So you'll notice that there are a few data points that list no county data is available. And so some of those are in progress. We're working out a process to get that data at the county level. So over time, as we have access to better data at the county level, that will get added to this dashboard. The second thing I wanted to add is that we gathered feedback before we created this dashboard to help us understand kind of what users were looking for when they would come to this. But we're open to feedback as you start using this dashboard. And if there are things that you're finding aren't working or missing or are things you really like, we're always open to hearing that and to kind of, as time goes on, make this more useful to those who are using it.
Wonderful. Thank you, Danny and Xana. I just have to say, like, Xana just demonstrated one of the things I value most in the partnership with Kids Count. You know, always willing to listen and like in it to win it in terms of making a product that people will use and is effective and helpful for them. So I do encourage you, if you have questions, to reach out to Xana and Danny. And yeah, my guess is you will find a very helpful answer on the other end of that. So thank you both so much for this and for making the dashboard a reality. Yeah, big thank you for that piece. All right, let's move into questions. And I think we have a small enough group here that if folks just want to unmute themselves and jump in, that won't be too wild or Western.
So, I mean, I can start if you start the ball rolling. I'm Matt Kelly with the Montana Public Health Institute. First of all, thank you and great work. I mean, it's just at first glance, it's impressive, and I want to dig deeper, and I have technical questions about some of the measures that I'm wondering how you got hold of for all the counties. But big picture question, I think this would be a resource that lead local public health officials would really respond to well, and maybe have even ideas on how to sort of amplify what you've done at the local level. So if Danny or somebody is willing to come on some of our local calls, we'd love that. Kind of give them a test drive of the system, and focused in a way that would benefit the health department and probably help make their continued assessment even better. So, but number one, congratulations, and number two, please let us know if we can be helpful in making that connection.
Thank you, Matt. We appreciate the congratulations and thanks, and also the offer of figuring out how we get this out there to more folks.
I have a
Holding
question
space for
about whether you're going to have the ability to update the data as you go along. Is there budget or just a plan to be able to periodically do updates and see what the longer range trends are?
Yeah, so I can share, with Kids Count, when we took over the project in 2020, we started thinking about what it looks like to provide comprehensive data like this. And so we've worked all of these data points into our just yearly plan of data updates. And so those have already, even before this dashboard existed, those data points were being requested and updated on the Kids Count data center. So anytime the data that we request and get updated on the data center, we will do an update to this dashboard so that it'll remain kind of updated as well with that data. And every data point gets updated in a different kind of timeline. Some of them kind of run on a calendar year, some run on a state fiscal year. So it really just depends on which data point we're talking about for when it gets updated. But we've just kind of folded it into our work plan in terms of continuing to keep this data updated.
Yeah, that's really excellent, because a lot of these good initiatives, they'll have a snapshot or some historical data set, and then it ends and you don't really see, the longer range patterns. That's really wonderful. You're continuing to keep that updated. And nice job, Danny, on pulling together and all of you that worked on that. It's a real nice, clean interface and easy to access. Nice job.
Hello, Stephanie Holly-Jort here with the Montana Public Health Institute. Again, I echo this is great. It's been a long time coming and you guys have worked so hard. So thanks to all of you. Great data here, and curious, will you use the local early childhood coalitions or your public health, or how will you reach into like Montana Hospital Association to get this information out about initiating prenatal care or follow-up care, some of the some of the other health information. And then I'm assuming your early childhood coalitions can really push out licensed childcare data as well. But curious, like a plan or how that looks for you guys on your end.
Yeah, thanks for that question, Holly. I always jump at the opportunity to talk about the early childhood coalitions. So just to give everyone background, HMHB convenes the Montana Early Childhood Coalition, which is a group of somewhere in the, ranging from 12 to 17 coalitions. Sometimes they're called intervention teams. Sometimes they're called Best Beginnings coalitions. Sometimes they're called collaboratives. But they're a group of folks that are working on systems across the state to improve early childhood and maternal child health. They were integral in this process, picking out these measures and making sure that those measures are actionable on their level. We built these for them. Like, this was tailored around making sure that early childhood and maternal child health workers and groups on the local level can take each of these measures and guide their work, and then also, measure their impact, right? So as far as specific plans, we don't have any future ones. We did run 2 pilot projects that are still in process. One, we worked with Anna Semple and the, oh gosh darn, I'm forgetting the name of her coalition in Missoula. I think it's called Early Start Coalition out of Missoula. And we were talking specifically about home visiting. And we tackled that because that community really wants to coordinate their home visiting services across the 5 different entities that are working on that. And it's a really difficult thing to measure, simply because you're comparing apples to oranges across several of those different home visiting programs, right? And so we're continuing to work with them on how we can pull apart the data that they do have. I know that they have a student that's coming on this fall who will be continuing to work on that data piece, and I will continue to provide some technical assistance to them on that, and figuring out, how does their home visiting task force that they have in Missoula under that early childhood coalition really start to know where home visiting is happening, and more importantly to them, where it's not happening. They're pretty certain that most of that home visiting is taking place in the very urban parts of the county and really not happening in the more rural spaces where we can, such as Sealy Lake, where they can, travel out to those spaces. That is allowable, but they're just not getting as high a registration. So that's one of the pieces that we're pulling apart there. Over in Bighorn County, I've worked with Shelley Sutherland, who I think is on this call. Shelley was also part of the early process of picking out these measures as the Bighorn County Best Beginnings Coalition convener. I worked with Shelley's coalition to figure out how some of these measures could be used in their work, and they kind of split the bill. And they chose 2. They're looking both at childcare, so what is their licensed childcare available in their area? They have a very low number of kids that could possibly be in licensed childcare in their county currently. I'm wanting to say it is in the single digits, but I can't remember that off the top of my head. But this is one of the places that coalition really feels that they can help more folks in the community who are maybe already providing care and are not licensed move into a space of licensure and be kind of a little bit of a buffer or an outreach between the child care resource and referral folks out of Billings and people within their county and community that they know and they trust and they send their kids to, and they want to help them be able to, become licensed and unlock those scholarships, right? So another place that awesome coalition does work is in prenatal or postpartum follow-ups. So we talked a little bit about, how can they continue to improve postpartum follow-up? They had already an existing program where they did outreach to families with new babies in their community that included some essential items and then also a resource guide to the things that they need within their communities. So really they kind of decided, let's stay the course, let that work. And then now we have, this piece of data that we can start to measure impact with and see if when we send out those kits, when we send out those new baby kits, we're also encouraging them to, you know, go back into for that postpartum follow-up visit, which we know is so crucial for maintaining health and continuity of care post-birth. Yeah, they can kind of etch and or watch and see if that works. They've got some great community partners that are doing that work already. And yeah, so those are two places where we try to really get on the ground and start to try and use the dashboard and the data measures. And I anticipate those kinds of opportunities to continue to come up. The early child coalitions, I'll just let me just scan through here. Casey Martinez is from Boys and Girls Club in Northern Cheyenne, is a participant. Ned Cooney is a longtime participant from the Flathead on here. Shelly Sutherland's on here. Callie Triller from Beaverhead County. There's just so many great folks that are participating in that group and are still invested in this project and want to hear updates at our monthly meetings. So I have high hopes that this will be something that communities can pick up and run. And HMHB is, there and available to provide technical assistance as we can, and think about how maybe we can make it an even bigger, more systems level impact.
Thanks, Stephanie.
Thank you, Holly.
Stephanie, hi, it's Ned. When you say longtime member, when you say longtime member of the coalition, I think you mean old, and I'll own that.
No.
That's how I'm feeling today, anyway. You would not be wrong in that. No, I wanted to first say thanks to HMHB and to Kids Count and Zana and Danny and just all the people that have put so much into making this dream come true, because you really honored the intent of what I remember from that big gathering at Blue Cross Blue Shield, those many years ago in the before time. And then you're responding to the keeping it local, keeping it real, keeping it actionable. All of that's really reflecting what we talked about in that room that day. So along those lines, on the local front, I know some of those measures are hard to get. I just wondered, is there anything we can do from the local level to connect, or is it more just working at the state bureau level to coordinate that data? And there may not be a simple answer to that, but I just
don't have a simple answer. Zana or Danny, either of you have a good answer for that? Places where local action can help with that data collection?
I mean, I certainly think stories about how important that data is for, improving the lives of children and families and what it means to your work helps us advocate for making sure we can continue receiving data, helps us advocate that we can request new data. Some of it is just figuring out what data requests look like if there's not already an existing system. And so I don't know that there's like a simple answer of, XYZ, this would get us there. Some of it I think is just kind of going through the process of potentially requesting private payer data for some of the wild child check and postpartum visit data to get a more population level look at those. But certainly it's always helpful for us to know how folks are using the data. And we have used that some to help advocate to continue receiving certain data points that were new to us. So foster care data was a new data point for us in 2020 that we started requesting at the county level. And we have used stories from counties that really desperately needed that data to start tracking how their programs were doing. And we use that to help us continue to advocate for getting that data. So the stories definitely do help on what the impact means for the data.
Great. Thank you.
Stephanie, you brought up the subject of the health needs assessments and plans. And, our observation too is it's real spotty and difficult, to get a consistent data set across those different documents that get produced by the counties. And I wondered if in working with Kids Count and the work you did, if there was any way that you could see some positive influence on getting those health departments in the various counties to really start keeping track of this stuff, or was that not a part of this project? Because it sounds like, you know, even if it wasn't, it could be something really positive that could happen.
I would say, Gary, that if I'm remembering back to doing that project, there were definitely some opportunities, but more important than opportunities, there were folks doing the work to help with that already. I'm remembering Carrie Pride from the state. She was generous with her time with me and talking about it and how she was helping counties and hospitals, you know, in their work separately and ideally together, be able to build these plans for their communities. I'm remembering Katie Loveland, who was a consultant who did a lot of these maternal and child health reports. And I was able to figure out in reading those reports, I'm like, there is a person out there that does these one way, and they all have maternal and child health, like 5 indicators that are in there. And I can't find their name on this. I can't figure this out. So I contacted the communities and I was like, who helped you do this? And it was Katie. And so there were concerted efforts that I think were also funded by the Montana Healthcare Foundation to really help communities build out these processes. And I see that still happening. I feel like I'm out over my skis commenting on what the tips of my skis commenting on what is happening right now with that process, because I'm not involved with any community right now. But thinking about ways in which, you know, what the ways that HMHB thought we could influence some of those processes is really helping get this data dashboard out there, and then asking people who are working in maternal early childhood to go to these meetings, to engage in the process, to be voices there, because really what we saw was who was at the table and who, you know, was able to participate in the process, because maybe that was part of your job and not just a volunteer duty you did in your spare time, really shaped the way that these reports came out. And so helping, you know, people who we work with really know that this is an opportunity for engagement and to help drive, you know, work and goals towards the things that they do already, but get that on that county or, you know, hospital level as well.
That's great. Yeah, thank you.
Well, okay, everybody. Are there any final questions? We told you we'd let you out at 12:45. So you would all at least have 15 minutes before your next Zoom room. Because the greatest gift you can give anybody right now is a little bit of time back. Yeah. Oh, thank you, Deb. Thank you for your work on this project. I will just take a quick moment of personal, I don't know, whatever, and just say, this is where I got my start, and the people that I have met are a lot of the people, you know, in this project were the people that are also in this room today. And it makes my heart swell that there are so many of us still here doing the work, and we're bringing in more good partners to really just support the people who are helping our families across the state, and also, you know, doing this great work together and taking care of one another. So this feels like a very joyous occasion for us, and I hope it does for everyone else. And I look forward to engaging more with you all. If you do want to be in this follow-up email, I'd love it if you could put your email in the chat. I know we sent out an invite, but I'm seeing some names on here that I don't think I had on my invite list, which is great. And yeah, I'd love to be able to connect with you all. Thank you all so much. Yay. All right, folks. Thank you, Xana and Danny. Woo! I 10, Danny. I 10. Done with graduation, done with your report, or this presentation. It's very, very cool, man.